Hi, I'm Dr. Gary Schwartz, and I've collaborated with Cassell Connolly Private Health Partners to create Schwartz CCPHP. So what made me want to become a doctor was that, I've worked in healthcare since I've been 16 years old. I was an EMT. I worked on an ambulance in Brooklyn. And then I was encouraged by my grandmother, who was a LPN back in the 1940s, and I went to nursing school. I went on to become a doctor, and I always wanted to be a doctor because I always wanted to be able to help my family and my friends and ultimately my patients. Hackensack had a residency program, and I applied here and they accepted me, and I've been here ever since. I'm converting to the concierge model because medicine has become very difficult for patients. It's been a broken system, very fragmented. Because of the complexity of medicine, doctors' offices have become very, very high volume and impersonal. That's why I decided to use Cassell Connolly to help me in the concierge model for my practice, is because I felt very comfortable at them allowing me to stay independent. So the amenities and enhancements to the practice that I'm most excited about is the ability to have patients come here, appointments the same day. I'm also very excited about for telemedicine, the ability to have them discuss their lab tests without having to make an appointment, the ability to see their lab tests, the ability to interact with me through various different new technologies. So the SENS solution was also a very attractive amenity because the sleep, exercise, nutrition, and stress management is what SENS stands for. This was a concept that Cassell Connolly introduced me to that I was very excited about for my patients, because I think that those elements are very important to somebody's overall health. So some of the other amenities that I'm excited about with the Cassell Connolly venture, working with health coaches. Very important. The health coach that is going to be working with the patients is going to be working with me so that I know what's going on with the patients from time to time about how their exercise, how their nutrition, how their sleep is, stress management. I think that's very important. And I think one of the major benefits of concierge medicine is allowing you that time to spend with the patients, and not only developing a personal relationship with them, but being able to explain to them in terms that they can understand what the lab tests are, what their x-rays or CAT scans may have showed, what this means, what we're going to do next. I have been thinking about this type of program for a very long time, and I understand that for many patients it's something that may be new to them and they may not be aware of what it is or what they're getting. You really want somebody that is going to be there for you. My grandmother used to say, if you have your health, you have everything. And that's really true. And I think that patients sort of owe it to themselves, and they deserve to have the people taking care of them that are going to spend that time and be there for them.